One thing I often see here in the clinic is someone comes in with a certain idea of what they think is going on with their pelvic floor. So they have a leaking issue, they have a heaviness issue, they have a pain issue, and they automatically think, I have a pelvic floor problem, my pelvic floor is weak, I need to strengthen my pelvic floor. Or maybe again, they've seen their doctor, they told them about their pelvic floor issue. And by the way, it takes the average woman 7 years of dealing with pelvic floor issues before they will actually talk to their doctor about it. 7 years! That's such a long time to be dealing with problems, you guys. So if that's you, please don't wait that long. Like, let's get it taken care of right now because it's honestly not that hard to fix. So don't wait 7 years, but they finally talk to their doctor about some issues that they're having. The doctor thinks, yep, this is a weakness issue. Do your Kegels or maybe try pelvic PT. Here's the problem. As someone who works with the pelvic floor, I'm going to tell you this muscle, and it's actually not one muscle, it's a group of muscles, ligaments, connective tissue, tendons that all work together with your whole inner core system. And they are responsible for so many different things. And so it's not just this little muscle that gets weak because you have babies and you're aging and all the things. And so you need to do your Kegels. It's way more complex than that. So I have seen several patients recently who came in and they thought this one thing was their problem. Come to find out, it wasn't their problem at all. It was something else going on. And we were able to work on it here and correct it within a couple appointments. And they were able to see fantastic results. So when I say it's complicated, here's what I want you to know. If you work with someone who specializes in pelvic PT, who knows what they're doing, who understands the complexities of the pelvic floor and the whole inner core system, we're going to get to the root of your problems. And then you will be amazed at how quickly you often see results. But if you just try doing your Kegels or you try to Google your therapy on YouTube or Pinterest or whatever, free thing that you think you can find, you're going to end up frustrated. And most likely you're going to be doing the wrong thing because you haven't gotten to the root of your issues. You think you have a weakness problem and you just need to do these few exercises and get stronger. Well, that could totally not even be what's going on with your body. Same with some of these like centers that have these like Kegel machines or actually like machines that they hook you up to help strengthen your pelvic floor. And I don't know, there's all these big claims like, oh, how easy would that be? Just hook you up to a machine and you're not going to pee your pants anymore. Again, that's not taking into account the complexity of the pelvic floor and inner core system, and that it's often not just simply a weakness issue. And so not only I have so many issues with machines because they don't even simulate how the pelvic floor works correctly. So I have a big problem with machines and using them as treatment. There are very small instances where they can be helpful, but most likely they're not. But the bigger issue is that oftentimes we're just putting a diagnosis of weakness on it when actually it could be something completely different and you could be even making your situation worse. So you guys, it is worth your time to see an expert. Work with someone who actually knows what they're doing, who's worked with hundreds, thousands of women with pelvic floor, inner core problems, and knows how to quickly figure out what's actually going on, get to the root problem, give you immediate treatment that's going to be helpful. And honestly, 2 to 4 appointments. That's all it takes. My patients average 2 to 4 appointments and they're done. Okay? If you have questions on this, I would love to help you or help clarify anything. Have a great day.